Jessica wants candy.
All right, I'd like to thank everybody for coming. So for the next few minutes, we're going to talk about communication in nursing and how it's important to increase patient safety and decrease things like falls. I want to hand out a survey. Kind of take one and pass it around. You can just fill out the front part as we're talking, and then wait to fill out the back at the end of the presentation. Good. And I'm going to hand these around too. So again, we're going to be talking about, you have the thing there now. We're going to be talking about using communication to increase patient safety. And we'll be looking at evidence-based practice as a way to increase that patient safety and decrease the negative outcomes that they have. So most of you probably know me, I think I know everybody pretty much. But if you don't, my name is Brent Rao. I'm a BSN student at McKendree University. But I've also a registered nurse here, and I work in the PACU. I've been a nurse for about 8 years, so it's probably not a long time, maybe for some of you, but so it's a little bit limited experience. But I've noticed in that limited experience, one thing that I have noticed is myself, when I'm taking report or giving report, a lot of times forget something, or I forget to tell the other nurse something, or I forget to ask them a question. So we're going to talk about that communication and how it can break down and what we can do to help keep that from happening. So. Okay, so that's the purpose that we're here for today. So we're going to go over some of the objectives that you have. So the first one, we're going to go over 4 objectives. And the first one is to discuss that importance of the communication in healthcare, and just in general. Second, we're going to increase awareness on how the standardized nurse reporting can increase patient safety. Thirdly, we're going to talk about how mobility cards can increase patient safety, which is something that I wasn't even aware of. But I found that they can. And we're going to talk about how bedside nurse reporting handoff at the bedside, how it affects patient safety. So communication, it seems pretty simple, right? It's something that we do all day long. We are constantly communicating, and we're giving information, receiving information. But it's actually pretty complicated, really, when you get down to it, and people get doctorate degrees in communication. So, but it is something that we do every day, and it is so innate in our daily lives that we sort of take it for granted sometimes, until there's a breakdown in communication, and we get negative outcomes, whether it be something as silly as, the spouse forgot to get the milk that you told them to get at the grocery store, right? That's a breakdown in communication. Or it could be something more serious, like, Brittany knows that berry is poisonous, and, I don't. She tells me, but I don't. For some reason, there's a communication breakdown there, and I eat it. I can die, right? And it goes to the same thing with an old elderly lady on the floor might be, let's say that she's 82 years old, independent at home, and her daughter stays with her sometimes. Well, let's say she slips on the ice at her house. No really fault of hers. She's independent, but so she comes in and has a fractured radius, gets an external fixator. So now she's in the hospital. She has this big contraption on her arm. It's kind of throwing her off balance. She's getting pain medicine. But her daughter is used to her being pretty independent. So she wants to help her get up and go to the bathroom. Well, if it's not communicated to the family member, to the patient, that this is probably not a good idea, you know, one fall could really change her life. Could be very dangerous. So, again, like I said, the breakdown in communication, we've all played the telephone game where we start here, I'm not going to make us do it, but we start here and I say something to Brittany and it goes around, ends up here and it's completely different. So that's what we're trying to do, is to eliminate those breakdowns in communication to improve patient safety as nurses. So the Quality and Safety Education for Nurses, the QSEN, it was developed in 2005. It was funded by the Robert Wood Johnson Foundation in order to figure out what we can do, what we could be teaching in nursing schools to instill these knowledge and skills and attitudes in order to better serve our patients through higher quality of care and higher safety. So they got together with the UNC, University of North Carolina School of Nursing, and the American Association of Colleges of Nursing, and they started a project. And they said, you know, you guys figure out what we need to be teaching. They came up with 6 competencies. 5 of them they got from Institute of Medicine. They added one, and so those are patient-centered care, quality improvement, informatics, and I really want to focus on these last 3. Evidence-based practice, safety, and teamwork and collaboration. So while all those are important and they interact with each other and they're dependent on each other most of the time, I want to focus on those last 3 and see how we can use those competencies to increase our communication between nurses and increase the patient safety that we give. Communication is also listed on the American Organization of Nurse Executives. It's an organization of leadership in nursing, and they also list communication as one of their 5 competencies in leadership. So for those of us in leadership or want to be in leadership, it's important to know those competencies, know the evidence-based practice behind them, and to be able to communicate that to our staff as well. So, the first one I want to talk about is safety. So, currently, the way we address safety here in this facility, I know, and as it is in most facilities, we have actually 2 safety meetings a week, Monday and Wednesday, and they mainly focus on falls right now, because we have just a little bit of a spike in falls recently. Some of the things they're already doing is talking about standardizing patient rooms. They're trying out some new bed alarms, see if that helps. And they're installing more cameras to where they can see. It's not really going to prevent that fall, but if we can see what happened during that fall, maybe it can prevent the next one with the new cameras. But like I was talking about earlier, the elderly lady with the external fixator, if she gets up, her daughter thinks, okay, she's independent, that's okay. We don't have a bed alarm on her because she came in as independent. And even though she had a fall, we might put her on a fall risk, but we may not say, okay, she's a one-person assist, two assists, right? So maybe we think, oh, her daughter's in there, she can help her. But her daughter's not properly trained. So let's say she has a fall in the hospital. Well, the CDC says that falls account for the majority of fatal injuries among elderly patients. So that's pretty extreme. If something is preventable as a fall, accounts for the majority of those fatal injuries to the elderly patients. So anything we can do to mitigate those is really our job, and it's what we're here to do. So how do we do that? Well, we do it through teamwork and collaboration and evidence-based practice. So through teamwork and collaboration, and I see another word for collaboration as communication. It sort of means more working together, but within teamwork is the communication that we have to have. So that means if I have a patient and they're a two assist, and I fail to let Heather know that when I'm giving a report, and she doesn't think to ask, well then now she doesn't know that. And so that puts the patient at risk for having that fall during that shift. And if the patient's there for, let's say they're there for 4 or 5 days, well they're going through a lot of nurse changeovers, handoffs, and that there's a risk for information being lost during those handovers. So one way we can mitigate that information being lost is standardized nurse reporting. Having one standardized way to transfer that information from me to Heather. If I've got a sheet of paper that has all this information on it, she's got the same sheet of paper. If I'm going over that and I don't cover something, she's going to be more likely to go, hey, you know, right here, what about, are they a 2 assist? Are they 1 assist? Are they independent? What's their activity level? Another way is mobility cards, and we'll get into that. I really like these. I think it's a great idea. I hope we actually go to doing something like this. I think it would be helpful. And the evidence backs it up. So, and also bedside nurse handoff, like I talked about earlier. So those are the 3 things we're going to cover in teamwork and collaboration as ways to increase patient safety and ultimately their outcomes as well. So as far as the evidence-based practice behind these, standardized nurse reporting, studies have found that communication breakdown is a risk during report. I think we all know that anytime there is communication, there's going to be a risk for a breakdown of that communication, like we talked about. And it's, you know, nurse report isn't always, you know, quiet. You and the other person kind of in a room by yourselves. You can talk. Oftentimes it's phones ringing, bells going off, pumps going off, other nurses asking you questions. So that really is going to increase the risk of losing that information, that communication. So communication breakdown during report accounts for 80% of medical errors. That's from the Joint Commission. That's a Joint Commission estimate. I've seen other estimates that aren't as high as that, but they're usually somewhere between 50 and 80%. So again, it's 80% of medical errors are believed to be caused by that loss of communication. Yeah. And there've also been studies that show that structured and consistent reporting decreases information loss during handoff. So if we have these structured and consistent reporting processes, that's going to decrease the chance that we lose some information that we already know is a chance that has a chance to happen, and it's going to increase the patient safety and decrease the likelihood that that patient is going to have an adverse event like a fall. Okay. So, the evidence-based practice for mobility cards. Like I said, I really like these mobility cards. You can see on your handouts of the PowerPoint. I hope they were big enough. Can you read them? Yeah. Okay. Basically, they're color-coded, and they're actually sort of pictographed. They have a picture there of what the patient can do if they're bed rest, independent, 2 assist, 1 assist. But those go on the patient's door, and they're just a visual communication. That's the way I like to think of it, of the mobility or the activity level of that patient, so that you don't have to remember back, oh, what was the activity level of this patient back 6 hours ago when I got report. Or these can go on the whiteboards in the room also. So I like to think of these as almost, it kind of personalizes it. If you say, okay, this isn't just something that management's making me do now. I have to do an assessment. Now I have to get a mobility card. I have to put it on their whiteboard. It's not just something else we have to do. This can be considered, that's the way I like to think of it when I was researching it, as it's communication from the patient to me, telling me what they need in order to be safer and to decrease their likelihood of really having a life-changing fall. So, and the evidence, there's studies that show, they've shown a 25% increase in nurses' knowledge of patient mobility activity level. So a fourth of an increase, a 25% increase in how much the nurse actually knows about the patient. And it could be, it's just from seeing that, being in the room, seeing that again on the wall, from not having to remember back from report. So, also a 15% increase in nurse confidence in assisting other nurses' patients out of bed. So we know that we're always trying to help each other out. There's a call light going off. Your friends in a room, your coworkers in a room, another room. You say, okay, I'll get this patient out. Okay, what do they need? What do I need to help them get up to, and not risk putting them in danger? And also, this is the big one, a nearly 50% decrease in patient falls in one study specifically. That was from 3.16 falls, so a little over 3 falls, to 1.5 falls per 1,000 patient days. So they cut their falls in half, which is really significant. So we talked about standardized report, nurse reporting, the mobility cards, and finally the bedside nurse handoff. bedside nurse handoff has been linked with decreased patient falls, decreased pressure ulcers, decreased medication errors. So not only is it helping in falls, it's helping these other hospital-acquired issues, such as falls, that are costing facilities money and obviously causing patients pain and hardship and sometimes their lives, really. So also, as a bonus, when we do patient or nurse handoff at the bedside, we get better Press-Ganey scores and HCAHPS scores because the patient feels involved in their care, the family feels involved in their care, and they're probably getting better care, as evidence from what we've seen with the decreased falls and the pressure ulcers and medication errors. So, just to summarize those three, standardized reporting, which decreases communication breakdown, which is linked with medical errors and poor patient outcomes. Mobility cards, they increase nurse knowledge about patient mobility and activity level, decrease patient falls, and increase patient safety. Bedside nurse handoff decreases patient falls, decreases pressure ulcers and medication errors, and they increased our Press-Ganey and HCAHPS scores as well. So it's really kind of seems a no-brainer to me. We should move toward this sort of at least these three strategies. You know, some people say that the bedside nurse handoff has kind of it costs more time, and but actually, you know, studies have shown that it can be done in just 3 to 4 minutes per patient. So you might spend 15 minutes doing a handoff, but you know, if that patient's going to have better outcomes, well, I think that's worth doing that. So, so now I'm going to open it up to questions, comments, discussion. Anybody, any thoughts that you might have had during the? Okay, that's okay. All right. Now if you'll flip your survey over that I had you fill out before.
You have some more?
Oh yeah, there you
No problems.
go. Yeah, so just after that, you know, it's the same questions. You just fill that out for me, and I would like to thank you guys so much for listening to my presentation. Thanks so much.